Coping with COVID-19, brought to you by Guardian Group. Live easy.
Well, let's see if Dr. Dick is on the line. Good morning, Dr. Dick.
Good morning, Lisa.
Oh, wonderful. So we have you on phone. We have Shamla on Skype. I'm in studio. That's what we call social distancing at its best, right?
Right. Well, I could tell you something. I'm not hearing Dr. Dick, but I have my questions, and maybe you could intermediate.
Okay, so Dr. Dick, are you hearing Shamla?
I'm hearing Shamla.
Okay,
I'm
right.
hearing her now. Good.
Okay, so go ahead, Shamla.
Good morning, Dr. Dick.
Good morning, Shamla.
How are you?
I'm fine, thank you. And I hope you are doing well.
Yes, well, we have to adjust the suit. So let me introduce you. Good morning, everyone, and welcome to Unique Not Different with me, Shamla. With me, I have Dr. Dick. She's a developmental behavioral pediatrician with a postgraduate certification in general pediatrics, and she specialized in behavioral pediatrics. And today, we are going to discuss childhood and the dynamics in which things are rapidly changing and how children should help, advise parents and children to cope with with these times. So, Dr. Dick, that being said, my first question is, given children as a whole, how, now they are transitioning to homeschooling and within the home itself, how do you advise parents to work with this transition without, having it just sudden, but wean it in with the child in the home?
Thanks, Shamla. Your question was not coming across quite clear to me. I hope I understood what you were asking me.
You want me to re-ask it?
Okay, so what I heard was that you wanted me to talk about how parents should cope with having children at home and transitioning to homeschooling.
Yes.
Well, I'm suggesting that during this time, parents should try to keep as much of a routine as possible. It doesn't have to be as strict as if the child is in school and lessons and what looks like schoolwork all day, but definitely try to keep a routine all through the day. Children thrive on regularity and routine, and that will help to ease any possible anxiety that they may feel or feeling a little bit out of sorts in a situation that they don't have a whole lot of control. Schooling at home or learning at home is not actually the same as homeschooling, so that there can be many teachable moments or many opportunities for the parent to help the child to learn something new, especially depending on the age of the child, within a routine, so that the learning can be fun. For children who might be a little bit older or those that are preparing for examinations like SEA, they might want to tune into the online classes for part of the day, but certainly children should have an opportunity to have recreation as well. And there's so many free online resources right now that they can visit a museum or play a game or something like that. And if the setup of the home allows, they should be able to get a break and play outside or have some playtime, free playtime inside.
Right.
Depending on the setup of the house.
So I know that even though you specialize in pediatrics, what advice would you give parents in itself, because they too are going through this transition, being home, having to see about their children? What advice would you give them?
I think parents need to try to keep a healthy perspective. This whole situation of COVID is affecting the entire world. And as adults, whether we are parents or not, having ourselves exposed to the information 24 hours a day can sometimes make some persons feel very anxious. So, we can give ourselves a little break from all the news and concentrate on perhaps just the main um, verified, accurate sources like the World Health Organization and so, rather than run after everything on social media and your WhatsApp and
Right.
so, and manage your anxiety, because children pick up on your anxiety.
Yeah, and in terms of, let's go down to children with behavioral disabilities and cognitive disabilities. In case they are contracted, no, first off, how do you advise parents and children to deal with isolation, especially children who have cognitive and behavioral disabilities?
I didn't hear the first part of the question. So are you saying that they are not yet sick and you want to know
With
how? Yeah,
isolation, yeah, how
okay,
do you
okay.
advise them mentally to deal with, isolation in itself?
I understand the question now. So let me just give a quick definition. So we hear a lot about quarantine and we're hearing a lot about isolation. Both of
Yeah.
them are used in situations like this to make sure that a disease doesn't spread or doesn't spread at all, or to limit the spread of the disease.
Mm-hmm.
And so if you are in quarantine, it means that you are well, and we want to restrict your movement because you've been exposed to someone who may have had COVID, and you
Right.
need to stay at home and be monitored to see if you get ill.
And in terms of,
Isolation,
uh, right, so
isolation, you're already sick, and we're separating
mhm,
you from those who are well.
right, and
Children,
hmm
if a child is ill, they may be a little bit um, out of sorts. If they are well, it might be that they're at home, they feel confined, and the same tips that I gave about keeping a routine, having access to games, reassuring them, talking to them in very simple language, using
yeah,
stories or graphics if necessary, appropriate to their level of disability, their level of development. Children
right.
who may have behavioral challenges or intellectual challenges, as much reassurance and predictability as possible, that would be
hmm
helpful.
Okay, and in terms of the, in case they have to go to the hospital, how would you advise, the medics and the different practitioners on how they should deal with these individuals who have, developmental, behavioral, and cognitive disabilities and disabilities in general?
I would think positive. Now, in this situation where we're dealing with COVID,
Hmm
this would be an opportunity for a parent who thinks their child may have COVID to communicate with the public health agencies or communicate with their regular doctor, who will help guide them through the steps to deal with the public health agencies, to get the child tested to see if they really have COVID. If they have COVID, then there's enough time to interact with the doctors in the public hospital and let them know beforehand
hmm
the things that make the child with disabilities different. So it's an opportunity for parents, even now, to just make a short summary of the things that make their child different and what they
Right,
normally do to help their child feel better.
right. And to wrap up, because I know we are running out of time to wrap up, right? And we should continue this later on. What would you advise, you know, um, in general, for persons, just for children, healthcare practitioners, and so on? When they come, if let's say they have a group of children coming, just a child coming in, how do you advise these healthcare practitioners and parents to deal with something like this, like, without panicking and so on? How do you advise them to deal with this situation?
Do you mean from the point of view of how the doctor, nurse, the health workers should
Yeah,
deal with? Well,
yeah,
I think it would be a teachable moment, and for healthcare providers who are not accustomed taking care of children or adults with disabilities, it would be an
Right.
opportunity for them to reach out to other colleagues who might be able to guide them on what special ways they can adjust how they are taking care of the patients. But there are certain principles that will have to continue in terms of how you deal with someone with a severe infection. But there are very many creative ways that you can reduce the anxiety of someone with disabilities that
Yeah.
would need to be in a hospital setting, and it goes both ways.
Right. And we have to leave it there. But I want to say thank you so much for, for coming back and giving your advice, because you have an overwhelming experience in terms of pediatrics in both the private and public sector. So thank you very much, Dr. Dick, for taking your time and, expanding your specialty in for the general public of Trinidad and Tobago.
Shamla, it is always a pleasure to speak with you, and it is my privilege, and I consider it a responsibility as well to use my training in the area of public education. There are many other things we can speak about regarding persons with disabilities and also more vulnerable populations, such as those who are at risk for abuse and violence. But
Yeah,
hopefully there will be other opportunities for us to
definitely.
have this kind of discussion during this very unusual time of COVID
All right, I'm going
affecting
to have to jump in there,
disability.
Dr. Dick. Thank you so much. Thank you, Shamla. We
Thank
have to get upstairs for the news right now, and thank you to Guardian Group.